Why did MDR-TB emerge after antibiotic success? Imagine a time when tuberculosis was a deadly threat, but then antibiotics came along and changed everything. They made TB a treatable disease, saving countless lives. Drugs like streptomycin, isoniazid, and rifampicin became the standard, and for decades, TB cases dropped significantly. But as these medicines became widely used, a new challenge appeared. Some bacteria started to develop resistance, leading to multidrug-resistant tuberculosis. This resistance happens because bacteria are tiny living organisms that can mutate. When antibiotics are used, they kill most bacteria, but some with genetic mutations survive. If treatment isn't completed properly, or if only one drug is used instead of a full combination, these resistant bacteria are left behind. They multiply and spread, making the disease harder to treat. This is why incomplete or incorrect treatment practices are a big part of the problem. Back in the 1950s and 1960s, as antibiotics became common, resistant strains started to show up. By the 1970s, bacteria resistant to drugs like isoniazid and streptomycin were identified. Resistance to rifampicin, another key drug, appeared in the 1980s. The 1990s saw a sharp rise in multidrug-resistant TB cases worldwide, especially in regions heavily affected by HIV. People with weakened immune systems are more vulnerable to active TB, including its resistant forms. Several factors fueled the spread of MDR-TB. In many places, healthcare systems lacked the resources to diagnose and treat TB properly. Patients might not have completed their full treatment course, or they might have been given only one drug instead of the recommended combination therapy. Such practices allow resistant bacteria to survive and multiply. The HIV epidemic also played a role, as it increased the number of people with compromised immune systems, making them more likely to develop active and resistant TB. To fight MDR-TB, health authorities emphasize the importance of completing full treatment courses and using combination therapy. Improving healthcare infrastructure is vital to ensure proper diagnosis and treatment. Surveillance systems help track resistant cases, and new drugs are being developed to address resistance. But these new treatments must be used carefully to prevent resistance from developing further. Public health efforts focus on educating patients about the importance of adherence and ensuring access to quality care. In essence, the rise of multidrug-resistant tuberculosis after the success of antibiotics is a complex story rooted in biological changes and social factors. It highlights how misuse or incomplete use of medicines can lead to bigger problems. Addressing MDR-TB requires a comprehensive approach that includes better treatment practices, stronger healthcare systems, and ongoing research. Always remember, if you or someone you know is dealing with TB, consulting healthcare professionals is essential for proper diagnosis and treatment. Staying informed and following medical advice is the best way to combat this ongoing challenge.